So good afternoon, friends. Today I have the distinct pleasure of spending some time with my friend and client, Dr. Zinaria Williams, who is a world-renowned ocular plastic surgeon, a hair transplant surgeon, and she also has a clinical MD degree in herbalism. She's practicing surgeon at Unger Medical, and she's treating hair loss not just surgically but also non-surgically. So Dr. Williams, one of the most curious questions I have for you is, you are such an interesting intersection of Eastern medicine and Western medicine. And oftentimes these two are like oil and water, they don't mix, especially when you are so trained in cutting edge surgery and yet you also did herbalism. So talk to me a little bit about that. How did you even fall into this, and how do you reconcile your two worlds every day when you're seeing patients?
I started out as a surgeon, oculoplastic surgeon, as you mentioned, so that is my base. But I recently did a 3-year herbal medicine training, and that taught me how to look at the body in a different way. And at first I wasn't sure where I was going to land because surgery is such a big part of me, and I decided I want to have it all. So I want to integrate the herbs into my current practice. And that's even including in my surgical practice. But one unique thing, like you said, is I can offer a broad spectrum. So when a patient comes into me, the first thing after they tell me their story is, where do you fall on this spectrum? Are we having a conversation about botanical options? Are we having a conversation about surgery or pharmaceutical medications? Because I can span the range. And so I like to be able to offer that to patients. And I think people are very responsive. At first, I wasn't sure how patients would take it, but people are very open to have many options and have, I think, also somebody they can have a conversation about it.
So can you quickly, for our audience, run through all the options so that they know? Because in my humble opinion, what happens is most men and women, when they have hair loss, they do two things. Either they self-medicate with things they find on the internet, they read up, and they buy one-off products, which will obviously not give them results because it's not a professionally thought out system, and therefore they give up. So that's one kind of people, and that's the majority. And then we have the small 0.1% population that goes up for medical intervention and they get put on drugs or surgery. So this is really for the benefit of that 99%. Can you kind of run through all the options that you think we have to treat hair loss, from like prevention all the way to advanced hair loss?
Yeah. The first thing, honestly, is to know why you're losing your hair. The most common cause is androgenetic alopecia, female pattern, male pattern loss, but there are inflammatory causes of hair loss. And if the inflammation is not treated, then whatever you do for the growth is not going to be sustained. So I usually tell people, if you're losing your hair, to just get it checked out, even with the trichoscopy, with the microscope, to look at the hair follicles to see what's going on. If it's your average androgenic loss, then a lot of people ask me, what's real? Is rosemary real? Is the laser cap real? Because they see all these things online, but you don't know what's going on, what's like real.
What's gimmicky, what's real.
Exactly. Yeah. So some of those things I can substantiate based on tradition, based on even some clinical trials. And I start with basics. I get the feel for someone. If they really don't want to be on any medications for whatever reason, then we talk about herbal medicine. So we talk about the vitamins. We talk about HairSmart vitamins, because I understand everything that's in that bottle, that's in that pill. I understand why it's in there, and I can't say that for every product that's out there. If they want something that has a DHT blocker in it, we talk about the botanical DHT blocker, which is not going to be as a heavy hitter as something like a finasteride, but it also is not going to give you those types of side effects that people are really nervous about. So we talk about the botanical options, but we also talk about red laser cap and laser light and how that can bring in blood supply. If someone does end up having inflammatory scalp condition, I always recommend that for inflammation. It's great for inflammation. In particular, also the vitamin, because it's got turmeric in it, and I love what you put in your ingredients because I can use it for patients who've got the inflammatory side and for those who have the androgenetic side.
Thank you for using the HairSmart protocol in your system and for also getting great results. Can you um, talk a little bit about the different kind of patients or the different types of hair loss that you have treated so far with the HairSmart system? Because we want to make this accessible so that people can also get on similar programs based on your experience.
So I've been using the HairSmart vitamin as well as a DHT blocker, along with the serum and the oil for patients who have androgenetic alopecia, female pattern or male pattern alopecia, and patients who strictly do not want to be on any medication. For example, I had a patient last week who is a breast cancer survivor. She has been through chemotherapy, radiation therapy, double mastectomy. She does not want to be on another pill whatsoever. So on top of that, her oncologist is not willing to put her on any sort of medication that will alter her hormones. So a DHT blocker is out of the question. So then I know where on the spectrum we're having this conversation. And I feel confident being able to offer things that can be effective that aren't in that line of pharmaceutical medications, and we're definitely not in the area of surgery for her. So we were talking about the red light laser cap and the options that are out there and why some are better than others. It's so confusing, honestly. I think it's confusing on purpose, red light, and what that means. And so I have that conversation with patients. I tell them my top choices, which are the ones with the highest laser diodes, which include the HairSmart ones. And that's something patients can do every day. And it empowers them to have something in their own hands that they can do for their own hair.
So it's very interesting that you bring that up. I have simplified my own spiel too, because I treat a lot of clients directly one-on-one outside of working with physicians. And the way I like to simplify it and break it down is the first thing we have to do to regrow hair is to stop the hair loss. We have to stabilize. You can't fill a sink with water unless you plug the drain. So that's your step one, your DHT blocker, your scalp health. So your DHT blocking, your shampoos and conditioners, and your scalp spray is for scalp health. So all those things are helping you stabilize, to make a healthy scalp environment, to stop the drainage from the DHT. And step two is, if you want to grow, you have to nourish the hair follicle. So that's inside nourishment. So the hair vitamin is a very heavy hitting vitamin. It addresses gut health, metabolic health, hormone health, stress, inflammation, and it has all the hair's nutraceuticals. So it's easier for me to explain. You got your protect, you got your nourish, and then you actively regrow new hair with the red light therapy cap. And it's going to actively metabolize all that nutrition, push the hair back in the anaging phase, and keep it longer in the anaging phase. So I just have found that I use like the gardening analogy or sink analogy, and they get it. You have to plug the drain, you have to turn on the faucet. So it's a systems approach. And I think my big takeaway from being in the hair loss industry for the last 15 years is the only difference between people self-medicating and going to a professional is then when you go to a professional, you get put on the whole system. And generally, it's not that the products don't work, but they don't work in isolation. So most people, they end up buying a great shampoo or they'll buy a great DHT blocker, but it's stabilizing, but they don't add the red light therapy or the nutrition. So it's often a system. And then when you don't have a professional to help you and track progress, they lose the motivation, they lose the momentum. They feel like it's not doing anything.
Yeah.
So hair loss is not a problem that you can fix easily. It takes like a good 3 to 6 months of commitment. So the number one thing that I tell my clients is I can help you. It depends on two things. Are you willing to follow the regime, and are you willing to commit for a good 3 to 6 months?
I agree with that. A lot of patients are afraid to go on minoxidil or something else because they say, I'm going to have to be on it for the rest of my life. Well, this is a progressive condition. So anything you do, you would have to continue it, or at least be on it for a long period of time to keep and maintain your goals. The first thing we notice is that people stop shedding, they stop losing hair, just like you said. And then we start to see the growth coming in. But you need all those elements. You need nutrition, you need the building blocks to grow hair. And if you don't have that, then how are these other devices going to work?
So this is a great segue into my next question for you. expectation management. It comes up all the time. Questions like, how long until I see results? Do I have to do something forever? How soon can I grow my hair back? Or what kind of growth or what kind of reversal can I expect? Can you speak a little bit about that, like with the HairSmart program and with the botanicals, or in general, how do you do expectation management for your clients?
That's a good question. So usually I do make it clear that whatever you do for your hair, for this progressive condition, you would have to continue to do it to maintain those gains because it is a chronic condition. But when you start seeing changes, that depends on the person. Some people are in a more aggressive stage. Some people have more aggressive conditions and not disease, but they have more, how to put it, but just more progressive.
Their hair loss is more progressed,
Yes, and they're just more advanced, I would say. And we see that as an ebb and flow for androgenic. There's this active phase and then there's a plateau. And there's an active phase and a plateau. So people who are coming in the active phase, they're actively shedding, they're losing their hair, but then it stabilizes. So I think it depends on where they are, but I always have the same conversation that we like to see the shedding to stop first, and that is the first sign. And that usually happens within the first 2 months or so. And by 3 months, we can get a sense of what direction we're going in, but to really see what results, we have to wait about 6 to 9 months to really see, because it takes time for that effect to do.
You know, with the HairSmart system, I always used to under-promise, over-deliver. And I used to say the same thing, 4 to 6 months. But shockingly, case after case after case, what we are noticing is when we put people on the system where they are on the 2 supplements, the DHT blocker, the vitamin, and the scalp spray, along with the cap, what we are noticing overwhelmingly is reduction in hair shedding in 0 to 30 days. And then we see repair in texture and density and growth. They just start to feel like their hair is better. They don't exactly know what, but they just start to report like, I just feel like my hair is healthier. And then right around the 3 to 4 month mark, because we know it's like that's the hair growth cycle, they start to see baby hair. So I even have a term for it, reduce, repair, regrow, in this order. If you want to steal it, I don't mind. As a perimenopausal female, I'm not only losing hair now, which is obviously stressful, but I have just pretty much I have suffered from hair loss my whole adult life. I'm an adult immigrant, stress, emotions, breakups, what have you, living away from home. And now that I'm in this industry, I pretty much see that 80 to 90% of all women are suffering in silence. There's so much stigma around even accepting that there is hair thinning. And even if you're in your 20s, I just feel like our hair starts to thin, our ponytails start to get smaller, and we just don't have the same oomph or the volume. And one thing that I've noticed is women do not like the word hair loss. They don't mind accepting their hair has thinned out, or they don't mind sharing even, I have lost volume. But as soon as you approach a female with, do you have hair loss? They're like, I don't have hair loss. So how do we, I personally am very passionate about treating female hair thinning and hair loss, and I think all women have some degree of it. So are you experiencing that in your clinic too, like female hair loss or female hair problems are exploding and more women are opening up to it?
We see a lot of women in our practice. I think almost 50% of our practice is
That's
women
a big
patients.
number,
I think it's a big number. I think the reason, it didn't start with me, it was with Dr. Unger, who's been in practice for a long time, but our approach is that we don't discount a woman's account of their thinning, as you said. So someone could come in not have any obvious signs of thinning, but she's telling me that she's lost half of her hair. And we say, I believe you. Whereas they may be discounted otherwise. So I think just accepting that no matter what a woman looks like, whether you think she's thinning or not, what she's telling you is accurate. And she's maybe coming in early, but we should still do something about it. On the other side of that, we see very young women in their 20s coming in with noticeable thinning of their hair. And so then the conversation is about nutrition, hormones, and getting a workup medically to see what's going on underlying that. But otherwise, it's being very open to this conversation and seeing how do you want how do you want to approach this? Because we can talk the spectrum again. And my patient last week, who is a breast cancer survivor, she can't do the DHT, any sort of botanical or pharmaceutical DHT blocker. So we'll work around that. We can do the hair vitamin. We can do the hair oil. She was asking about rosemary.
Because it helps with blood circulation.
Yes.
And chemo-induced hair loss, there is a real problem of blood circulation. So once scalp massages are actually, there have been studies done on it. Scalp massage with a good hair oil helps wake up all the dormant follicles because it helps with blood circulation.
Yeah.
So they're getting the signal from the blood that, okay, nutrition is coming in and they start to wake up.
Right, but with the actual nutrition in the oil, because there was a study maybe 10 years ago that found that rosemary oil is as effective as 2% minoxidil.
Even with Bringaraj, Eclipta prostrata, it's actually clinically proven that it's as effective as minoxidil too.
Right.
Yeah,
So to have these options that are botanically derived for patients like this, she's fine putting an oil in her hair. Not everybody is. So then the serum is another option. It just opens up so much, and patients just feel good about having other options, and they're not just being tossed minoxidil into one thing. So I love being able to offer these things and be able to treat patients.
When should a guy or a female, male, female, when should they actually, at what point in their hair wellness journey or hair loss journey, should they consult a professional?
I think that's a big question for women, not knowing if they should go in, if there's something wrong, are they imagining it? A lot of women, patients also feel like it's frivolous and they're just being vain and they're really down-putting.
They put themselves last,
Yes.
and self-care comes last.
Right. And so I try to give people encouragement that I'm glad you're here sitting in front of me, because this is important. It's easier to hold on to what you have than to get back what's lost. And so I think signs where you're seeing hair, more hair than normal coming out in the shower, hair on the pillow, more hair in the brush, your ponytail feels smaller than it has in the past. You were quite literally seeing shedding and hair coming out. These are signs of maybe a telogen effluvium, which is a shock loss, the more active phase of androgenetic loss, or even inflammatory conditions, which should be treated a little bit differently than everything else.
I'm a huge prevention and preemptive person. You know me, I'm in holistic and yoga and Ayurveda. For me, it's very, very simple. If you start to keep your hair down a lot, or if you just start to feel like you don't feel comfortable pulling your hair back, or if you're opting for more and more, like, these are all telltale signs. A very simple cue is, if a picture from a year ago, you have better hair than you have now, and it has not improved in a year, go see someone.
Right. Because you want to know what's going on.
Yes.
And that's the most important, because some of the treatments that you see online are not appropriate for every type of hair loss.
And a huge part of treating hair loss in the very first 10-15 minutes is just destigmatizing it, and also making sure they know they've done the right thing. Like, we put ourselves last.
Yeah.
And more than that, we just feel like it's something we did to cause it. And I always tell my clients, you didn't do anything, you're giving something called life. So chances are you had a bunch of stressful episodes. You probably had a couple of kids. You probably you had a breakup or two, maybe a few house moves, even planning a wedding. Every time you tried to lose weight, you probably had some nutritional deficiencies, you lost hair, you had some stress. So I tell every person that I'm consulting, hair loss is a whole story about you having lived your life, your diet, your breakups. I mean, somebody who is taking Harvard exam week, that's a lot of stress. It's going to have a little bit of impact on your nutrition, on your hair, all of that. So, like, hair loss happens because life is happening.
Your hormonal status.
Yes, hormones are hugely changing. So I often find that there is a huge weight that lifts off someone's shoulder when you tell them, you didn't do anything wrong. It's your life happening. And we are not hermits. We cannot stop living life.
Right.
So,
and that there are options.
Yes,
there's a range of options. And for some patients, honestly, they may want to do botanicals. And then in the laser cap, and if we don't reach exactly, like, say there's still one stubborn spot, we can do surgery there. Like, there's a range of things. So it's not that you are ever stuck. There are a lot of options, and just having somebody who's open to talking about all the options, I think is important, and every patient deserves that. So when you see patients who have female or male pattern loss, how do you describe it to patients?
So, I see patients everywhere in aeroplanes because people know I have a hair loss treatment company. Everybody just feels it's okay to stop me in parties in a social setting and get me to give them a consultation. My first telltale sign of genetic hair loss, by the way, androgenetic hair loss, genetic hair loss, male pattern, female pattern, these are all the same thing, just different synonyms. If the hair in the back of your head, if you just feel it, it's thicker than the hair in the front of your head, it's the telltale sign of androgenetic alopecia. You can correct me on that, but that's like a telltale sign because that's genetic hair loss. And 80% of all adults have genetic hair loss as their primary hair loss, but often hair loss is a mixed cause. In today's day and age, I put hair loss in 4 buckets, like 4 big buckets of hair loss. And of course, then you can further diverse, but genetic, which is DHT related, lifestyle, which is my second big bucket, stress, food, which can cause inflammation, braiding, chemicals, products you put on your hair, how much alcohol you are doing, caffeine, nutrition, diet. This is all lifestyle. So what we bring on, it's like my second big bucket. The third one is illnesses. Do you have an autoimmune disorder? Are you PCOS? Are you anemic? Do you have thyroid? Did you go through chemo? So illness-related hair loss, like illness-induced hair loss. And the fourth one is pollution, which is not so prevalent in America, but in China and other countries, Asian countries, there's like pollution-related hair loss, just hair falling off for 18-year-olds. So in the first 3 buckets, what I've noticed is lifestyle causes an early onset of male pattern, female pattern. But in today's day and age, lifestyle is just as big of a factor of hair loss with genetics, and it's a moot point to treat or to say you just have one kind of hair loss. Everybody has lifestyle-induced hair loss because we are surrounded by all these stimuli of stress, inflammation, our diet. Even apples to apples, soil has lost a little bit of nutritional value over the last 100 years. So which is why I feel very comfortable with sharing this thought with most of my clients, saying these days it's a combination of androgenetic and lifestyle-induced hair loss. Almost everybody needs to be on some nutritional supplement.
Well, so good segue. I'm curious if you could just describe why you chose certain elements in your formula.
That's a great question. I get this a lot, that why did you create such a vibrant hair vitamin? I really didn't want to create a hair vitamin. I wanted to create a whole body health vitamin where you fix not hair loss, but you try to treat what's causing the hair loss. So if you notice, I have 5 major components of different nutritional groups in the hair vitamin. I have the daily multivitamins. Then I have all the essential minerals that help with absorption, like iron, zinc, selenium, magnesium. Then I have biotin, which is a superfood for hair specifically. Then I have amino acids, which is the building block of keratin, which is the building block of hair. And then I have these magical Ayurvedic herbs that are not just treating hair loss, they are treating your gut health, your metabolism, your inflammation. So I've just known and read about it my whole life. I've been practicing Ayurveda and functional medicine my whole life, and I know that you can't treat hair loss until you treat the whole body as a connected being. The other reason why I made the formula so powerful is I'm very value conscious as a person. I want to give a lot away, and most people, they end up spending between $200 to $300 if they want to supplement optimally. So most people are on a turmeric, zinc, selenium, ashwagandha. So I wanted to create, it was a very tough journey for me to make that formulation. It was the toughest formulation for me because I wanted to balance between cost of production, between health benefits, and having too many servings. It has been the toughest formulation in the whole brand. So I ended up with that formulation, and now my pitch is if you take that and a D, you're good to go. So I feel very honored and I feel very validated when I get the feedback, you're helping me with my whole body health and you're helping me save a lot of money. Those were my 2 big objectives.
I hear that from patients, that they just feel good on the vitamin, and I like that people can take it I like that women can take it in all stages of their reproductive cycle.
Yeah, and
Trying
I
to
wanted to
conceive.
create something that my whole family could be on, and it was so. Sometimes it's hard because they are like, it's a hair vitamin. I'm like, no, it's not really a hair vitamin. It's a full body health vitamin.